Our region's business is sponsored by PNC for the achiever in you. Our region's business, improving our economy, creating jobs, and strengthening communities. Innovation, collaboration, transformation, and the people making it happen. Join us as we take a closer look at our region's business. Now, here's your host, Bill Flanagan.
Today on Our Region's Business, we're taking the pulse of small business as we near the end of 2017. Plus, the YMCA is looking for a few good men and women to mentor a number of our region's best and brightest young people. But first, Philips' big bet on innovation in the heart of our region. The Dutch company recently cut the ribbon on a new innovation center in the heart of Oakland, just steps away from the campuses of CMU, Pitt, and UPMC. The tech talent who work there are developing new hardware and software to enhance sleep and respiratory care. The investment represents a move back into the urban core from Murraysville, Westmoreland County, where Philips does its manufacturing. City of Pittsburgh Mayor Bill Peduto talked about it during the open house.
What we're seeing today is an international company understanding that there are places within this world where cities that have the collaboration between the pipeline of talent, between the pipeline of R&D, and with the support of government, are able to do amazing things.
And Philips has indicated that it just may be the beginning of amazing things to come. John Frank is CEO of Philips Sleep and Respiratory Care. Good to have you. Welcome.
Hey, Bill. Thank you for having me here today.
Yeah, this is a real signal moment, I guess, for Philips. Although we should mention that although Philips is relatively new to our region, the company is not, right?
Indeed. Right. We've been in the area for 40 years as formerly Respironics prior to the acquisition by Philips in 2008.
Okay, so for people, I can't imagine anybody in our region doesn't know about Respironics, but for those who don't, what is it the company and now Philips does?
Yeah, today what Respironics has done for years successfully is we've developed treatments and diagnostic capabilities for sleep apnea patients, patients that stop breathing at night. Along with sleep apnea, we've developed innovative solutions to help patients with chronic respiratory disorders in the home, patients with ventilatory disorders or in need of oxygen. So we've had quite a success and ride over the years.
Well, and I remember the company was really a pioneer in all of this back in the beginning, right?
It was, and it originated right here in Pittsburgh. It was a marriage between some clever innovators at the time, working closely with physicians at local hospitals, institutions, Presbyterian Hospital, if you remember the name, and together they worked on the solution to treat sleep apnea, and from there it evolved into a much bigger company today, being over 1,700 employees just in the local area supporting that business.
1,700 just around here. That's pretty amazing. So tell me about the new innovation center. Where does that fit, and why did you decide to move into the city to do it?
Well, Bill, let me tell you about that, but maybe just to back up a moment on our approach forward as a business. Today, Philips is largely focused on consumer health along with its professional health business of treating patients in the hospital. And by marrying those two together, our goal is to address the patient's needs across the continuum of care, from prevention to healthy living to diagnosis, treatment, and into home care. So that brings into play what Respironics contributes to that approach is by serving patients in the home and treating them more effectively. We know that there's more chronic illness and more people that need help in the home, and a challenge with the resources to treat those people in the home.
And with an aging population, that group is only likely to grow, right?
That's exactly right. So our intent is to build out not only our solutions and capabilities to treat these patients, but to also help optimize the way that they're served in the home and to help prevent hospital readmissions. As an example, over the years, we've created a digital platform that allows us to treat the patient with sleep apnea in the home, monitor their care to coach them back to a better compliance rate, and to share that information with everyone in the ecosystem, the physician, the payer, and the patient. Over the last 10 years here in Western Pennsylvania, we've built the capability to monitor over 5 million patients every night. and to build from that experience better services to help these patients. So our intent by moving into the local area is to capitalize on that experience and bring those experts to the table to do that as well in other areas such as chronic obstructive pulmonary disease and other respiratory areas.
Well, I was blown away when I had the chance to tour the Innovation Center. You have all these software types, and they're developing the software that makes all this run on the cloud, as well as how all the technology integrates. It's really becoming incredibly sophisticated.
It is indeed, and it's the way of healthcare in the future, and it requires a special talent to be able to sustain that capability and to grow it, and that's indeed why we're in the Oakland area to capitalize on the capabilities that are around us in that environment.
So the challenge to find a spot to put your operation so close to the University of Pittsburgh?
It sure was. It took us a while to find the right place, but as you experienced yourself, I think we're right in the heart of the district, minutes away from the University of Pittsburgh, Carnegie Mellon, and UPMC. So right where we want to be to share our capabilities as well as to gather from them as well.
Will you really be partnering with those other institutions in Oakland as well as looking at it as in terms of talent?
We will, and we are. As an example, with Carnegie Mellon University, we have a co-op program with their engineering capabilities, and we bring in students early on to help us with some of our needs that we see from the market, and we hope in turn we're giving back to them and giving them experiences directly with a proven business model like ours.
Well, Philips is a great global brand name and doing incredible work, but having a presence in Oakland, does it give you an edge when it comes to attracting talent and competing with all these other global brand names we seem to have in Pittsburgh these days?
Well, we certainly hope so, and we think the edge for us is for the people who have expertise in this area and who truly want to help people and help with a healthcare business model, we're the right selection for those individuals.
I hadn't thought about that, but they're really sort of the social, human services, human well-being mission to what you all do with your technology.
It's our passion. It's our passion. It's what we like to do, and we think many of the people who work for us love what they do because of that.
And then do you anticipate growing your presence in the city over time?
We anticipate growing. We see a big opportunity in front of us with a growing population of patients that I talked about, and the lower cost setting of home health care. We think we're in the right place to grow this business and to continue to evolve and have the success that we've had for the past 40 years.
And this should be good news then for your manufacturing in Westmoreland County as well, right?
We think so, and the manufacturing footprint will remain in Westmoreland County as we continue to grow.
All right, well, really exciting. Congratulations. Great to see this homegrown success story gone global. John Frank, CEO of Philips Sleep and Respiratory Care. Thank you so much.
Thank you, Bill.
Yeah.
Appreciate it.
Well, there appears to be optimism out there among small business owners. We'll find out what PNC Bank found when it took their pulse this fall. Stay with us.